Again, I'm Marilyn Singleton, and I'm this year's AAPS president, and I have the horrible task thank you, of having to follow all of those amazing speakers from today. They were just fantastic. And I'm supposed to lead us in to medicine and politics without giving you indigestion before dinner. So hopefully my little travel log will help soften the blow a bit. This is a trip through the Panama Canal and the jungle of politics and medicine. I ran for Congress several years ago, so I learned politics is a total jungle, a dog-eat-dog world, and you come out very scathed. Unfortunately, medicine is starting to become the same way. Government involvement in medical care has just created a tangle of regulations and spiraling costs year after year, and the regulations and costs of compliance have just gotten out of this world. As Dr. Page mentioned, that health information technology for economic and clinical health, or HITECH Act, added all sorts of problems. It was the meaningful use of EHRs. The disgusting part about the whole act was that it was tucked into the stimulus bill. Who was paying attention? And this is how they get us. This is how they do things. And those incentives for using EHRs soon turned into huge penalties, up to $1.5 million, all for not using electronic records. Give me a break. So then, value-based programs were foisted on practitioners. The Affordable Care Act in 2010, the Medicare Improvements for Patient and Providers Act of 2013. Who's even heard of that one? The Protecting Access to Medicare Act in 2014. And then, of course, the grandmama of them all, MACRA, in 2015. Payment reductions, all for not doing all those hideous metrics that Dr. Page told you about. But it gets worse. That there were more and more layers involved. QIN, QIO, Quality Innovation Network and Organizations, Qualified Clinical Data Registry, Quality Payment Programs, Enterprise Identity Management, Healthcare Quality Information Systems. You get the picture. You don't even know what this stuff is, but you are expected to comply. Then entered all the large healthcare systems, buying up practices, then merging with each other. The patients had fewer choices and higher costs. The excuse that they gave at the time was that everyone would get better care because they were in this big organization. But guess what? The jig is up. There was just a huge multi-center, multi-city study that showed there was no change in quality from small practices to large hospital things. So this is what these folks want. They want us to sink. They want us to fail. They want our patients and all the money that the patients bring in. But don't be fooled. These folks can really sneak up on you. And they get real close. But these big boys aren't invincible. See those two little men in a rowboat? When those great big giant boats go through the Panama Canal, like they've been doing for over 100 years, those two men in a rowboat were what brought out the ropes that they hook onto the boat to guide them through the canal. And they still do it. They have rooms and rooms of computers, but still it takes human beings to take out those guide wires to the great big boats. Sometimes it seems like nothing can stop them. They can just barrel down on you. But you have to remember, when one door closes, another door opens. It can be pretty scary coming out of that jungle. But don't get sucked in, no matter how lost you feel. You are no one's drone. You are not a machine. You are a doctor, and you're not a provider. You know that you can't be complicit in herding patients into a government program. This is what your outpatient medicine can look like. That is not for us. These are programs that they know they can't pay for, and all these unicorn billionaires, and mind you, there's only 530 billionaires in all of the United States, yet we're told that they're going to pay for these programs. Ain't going to happen. When the money runs out, our patients are going to see the real world consequences, and we know what total control does. Fewer services, long waits. And for the older folks, me not included, hospice is going to be the new medically necessary treatment. Mark my words. And for the disabled, same thing. They're sending people to hospice after 1 day of a trial of antibiotics. What antibiotic works in 1 day? And now there's a study out that shows that hospice patients are dying of sepsis. Why are they dying of sepsis? Because they never got any antibiotics in the hospital. It's disgusting what's happening now. And we don't want that happening, and we're not going to be complicit in that. This is a scheme of the Panama Canal. France had tried to build it. Then Theodore Roosevelt said, we can do it, after France failed. There were tons of naysayers. The workers were dying. The tides were washing away everything they did to build the canal. The doctor said, he told Roosevelt, don't give up. We can do it. The doctor took oil down there, sprayed all the plants, got rid of the yellow fever so the workers stopped dying. He got an engineer friend that said, well, this isn't a problem. The Pacific Ocean tides were the same as the Atlantic Ocean tides, so the tides were washing everything away. He said, raise the canal. So that's why we went through all those locks. First you go up, then you go down, and then you come on back out. It's an amazing engineering feat. Well, I'd like to tell you some of AAPS's we will build the Panama Canal moments. We've written numerous op-eds, press releases on Medicare for All, the dangers of government takeovers, the dangers of the new bizarre end-of-life treatment, and many, many more, resulting in about 100 radio and TV appearances just since October. Plus, we have our legislative updates that are opened by folks from the Heritage Foundation every time they come out. One of my new things is I've become now sort of a go-to person for RTTV cable station, and they discovered me via a journal article that I had written some time ago called Somatizing America about overprescribing. And so she's had me back, and every time I go, I give her another journal article and say, okay, let's do a special on that now. And our statement to the Senate's Finance Committee on drug pricing was widely cited in Health and Business News. Our DOJ letter regarding the CVS-Aetna merger is still being quoted in news articles and is cited 4 times in the DOJ brief. We've had letter writing campaigns for all the members on FDA Drug Shortage Task Force, the IRS, HHS, Department of Labor, trying to get more favorable treatment for DPC. The HHS regarding site-neutral pricing, so hospitals couldn't get paid more than doctors. E&M code changes and tons of other legal challenges that you'll hear some more from Andy Schlafly about. And Dr. Huntoon did not brag on himself, so I will. He has become international with his sham peer review knowledge. He has been to Australia, and a whole group of Australian physicians have taken him on to help them with sham peer review, and he spoke at an international ethics conference in Israel, and so now he's taken the fight against sham peer review to Israel. And through all this, believe it or not, we even get some fan mail. Any physicians not listening to you or not ready a member, have to have their respective heads buried in the sand like ostriches. You are the only remaining voice for medicine as it should be. And one last thing, we do have a political action committee, and thanks to Dr. Held and our political action committee, we have to help feel that we helped get Chip Roy elected to Texas. So, we all know that this is not what our patients want, the massive health care system. This is what they want, personal, individualized care. We know on the horizon, people understand this, that competition and choice, that's what decreases cost and increases quality. We want health savings accounts for everybody. Medicare patients, health sharing ministry patients, everybody should get the chance to help manage their own care. Let Medicare and Medicaid patients see whatever doctor they want, whether they're in or out of those contracts. And there's so many other ways to increase all the options available to patients and to doctors. And it's your job, our job, to tell anyone who will listen, coverage is not care. Control and coercion are not compassionate. And a government big enough to give you everything you want is big enough to take away everything you have. Some say maintaining physician independence and autonomy is a lost cause. But as Winston Churchill said, lost causes are the only ones worth fighting for. But that's why we're here. AAPS has your back. Thank you.